Good day, everyone. If you're tuning into today's e-learning, we'll be covering a brief introduction to getting rights right. Let's get started. So if we are going to get rights right, we need to start with some foundational knowledge and belief. I'm going to talk about the concepts of duty of care versus dignity of risk and how they sometimes get misunderstood in our services. So imagine if there was a continuum between these two concepts and duty of care was on the far left of the continuum and dignity of risk on the far right. So the term duty of care refers to a legal responsibility that was set up to ensure people with lived experiences are not harmed by the services an organization and its staff provide. They needed to be put into place because people were often being mistreated and abused in the past, and even to this day, people still experience such treatment. So over time, this concept of duty of care has been misconstrued, and we developed this understanding that we had an obligation to protect people with lived experiences from themselves, to protect them from the choices they are making, to protect them from insignificant or unfounded harm, to protect people from making mistakes. And this is so far off the mark from the original intent. Remember, it was put in place to protect people from us, and we have a duty to not hurt people. And so on the other end of the continuum, there is this dignity of risk, and this refers to the right that every one of us has, the right to make choices, to take risks, and even to make mistakes. And even to make mistakes over and over again so we can all learn from them. If I were to ask you, how many of you did something and said, I will never do that again, and yet you did it again? So dignity of risk is about that freedom of choice. And it was first coined in 1972 by Robert Persk in relation to people living with disabilities. And it was in reaction to what people were experiencing under the lens of duty of care. And so supports were overprotective and paternalistic in nature, and the approach was obviously patronizing, and it diminished a person's freedom and dignity. Historically, services have started from the left side of the continuum, with duty of care as we interpret it today. We protect people because we care for them, and we don't want to see any harm come to people. So we bubble wrap them, we Velcro them close to us, all in the name of safety, therapy, and policy. And when we feel it is safe and comfortable to do so, that is when we start encouraging people to make decisions and choices and slowly move closer to the right side of the continuum. And people's education, experience, and opportunities to different exposures are not robust. And people have an impoverishment of life experiences, including those experiences of failure and disappointment. And that is just wrong. What we should be doing is starting from the other end of the continuum. Start with the dignity of risk, and then we can balance that approach with duty of care. We need to recognize that every person has the right to decide how they want to live their life. And the bottom line here is, if you and I can choose to make certain decisions, so can the people we support. And our role in all of this is to provide people with exposure, experiences, and education so they can make informed decisions and be there to support, even if the decision is not exactly what we would have made. But remember, this decision is not about us, but it's about the person. And sometimes there are situations when we have to step into duty of care, but our starting point should always be dignity of risk and crossover, not the other way around. And so we need to be consciously aware of the extremes on both ends of the continuum. With duty of care, we need to be careful not to overprotect people. And on the side of dignity of risk, we can't neglect or abandon people to their choices. So now that we have this foundational knowledge, we can start to uncover the rights restrictions that some of the people we support may experience. And in order to learn more about rights restrictions, please tune into the e-learning on Rights Restrictions 101. So thank you for signing on, and we'll see you soon.